Hello, I'm Sope Owoaje. I'm a nurse, I'm a mental health advocate, and I'm a network representative for Jack.org. When we talk about mental health, it is crucial to understand how fundamental it is to our overall well being and thus should be treated as such. In any given year, 1 in 5 people will experience mental health challenges, and only 1 in 3 will seek the appropriate services. Suicide is the number one health related cause of death for young people in Canada. And in the North, the state of mental health care and suicide rates are frightening, and over 8,000 youth are expected to struggle with their mental health at some point. Mental health is like physical health, but involves our thoughts, feelings, and behaviors, and can be impacted by various factors such as biology and genetics, individual environment, culture, and societal structures. One of the greatest stigmas is that mental health and mental illnesses are the same. Mental illnesses are clusters of symptoms that can affect our mental health. 1 in 5 people may experience mental health challenges, but 5 in 5 of us have mental health. Stigmatization of mental health has always been present, but even more so for BIPOC, Black, Indigenous people of color communities who often face significant barriers. While health conditions do not discriminate, people from some demographics often have difficulties accessing mental health treatment and services, compounding the struggles to spread awareness and access better health care. To understand the plight of BIPOC mental health, it's crucial to take a deeper look at the obstacles that keep from seeking help. Stigma. Stigma can be cultural. Various groups of people view mental health differently. As a Black woman and growing up in an African household, mental health was not something often discussed. When in distress, you could often hear there are bigger problems in the world in relation to world hunger or homelessness. We are meant to be strong and resilient, and mental health challenges can be seen as a form of weakness. Due to colonization and standing colonial structures, struggle has become such a natural part of BIPOC lives due to slavery, constant discrimination, residential school, that anxiety or depression may not be viewed as health issues that warrant professional help. Awareness plays a huge role in the way mental health is addressed. Many people from BIPOC backgrounds may be distrustful of the system. Raising awareness and providing appropriate information can help address the disparities in the mental health field. Up to this point, accessing mental health services has been a privilege and not a right, leaving many individuals without essential support. In some provinces and territories, psychiatrists are covered by provincial or territorial health insurance, but psychologists, psychotherapists, and counselors are not. In other provinces and territories, therapy is only covered if it's through a hospital or mental health institution. That means that most people are left paying out of pocket. Fortunately, there are a number of private mental health clinics across the country offering services that are either free, covered by private insurance, or adjustable to individual income, but they're not always the easiest to find. In the North specifically, there are significantly less mental health services available. The services available have long wait times, transient support, and may not be in Indigenous language. Individuals that require extensive mental health services are often sent out of territory to receive treatment that may not be culturally competent or safe. Language is not always translatable. Trauma and feelings may not always be translatable. It's important for individuals to have access to services that provide competent support. Perhaps the biggest challenge for BIPOC is the prevalence of discrimination and biases from mental health care providers. Sometimes these biases are explicit, other times not so much. As a result, many people from BIPOC communities are less likely to receive treatment because many providers are not trained in culturally competent care. For example, in Nunavut, counselors who come up to work are not always versed in the colonized history of the territory and may have preconceived biases. This can be dangerous as communities are healing from recent and intergenerational traumas. The mental health system is complex. Many people are unaware of what programs are available for them. Once policymakers and those behind the mental health system have this understanding of their roles and responsibility in curbing disparities through destigmatizing mental health through mental health education, increasing accessibility, improving the social determinants of health, and offering culturally competent care, they can provide better mental health care for all, including BIPOC communities. Thank you.